Welcome to the Revita Health and Wellness Show. Dr. Peter Fotinos is with us today. How you doing?
I'm doing well, Francine. How are you doing?
I'm doing great. Let's talk about erectile dysfunction.
We'll do that.
A lot of people call it ED for short. Let's just talk about it. Men call you up, or do their wives call you up?
It's mostly men that come in and see me for that. That's one of the main reasons. One of the two main reasons men come and see me are as far as energy and fatigue and physique. And the other is erectile dysfunction.
Okay.
There's three ways we kind of approach erectile dysfunction in our clinic. The first way is the hormonal way. We look at their testosterone level, which is very key and related to important factors of erectile dysfunction, including if you have low libido, which can affect your erections, but also the direct effect of low testosterone on erections. We kind of try to correct those levels and see if that may be the issue. If that doesn't work, it may be also estrogen level. And then it's interesting, again, a lot of clinics I know around the area, and a lot of doctors say estrogen's bad for men. It's not necessarily true. If you look at the research, it's not. And the most recent study was done in 2013, in September of 2013. It was done by the NIH, the government, and it was published in the New England Journal of Medicine. And what they looked at to see was what happens if you block estrogen versus not block estrogen in men who are on testosterone. And what they found was that, and this is interesting, that estrogen deficiency primarily affected body fat, so increased body fat, but more interesting, if you're estrogen deficient and testosterone deficient, your sexual function is affected. It will decrease your sexual function. So if you replace those, they found that those things will improve. So estrogen deficiency and testosterone deficiency are involved in sexual dysfunction, okay, or erectile dysfunction. The other thing that we look at is thyroid. Thyroid is important for sexual function as well as libido. There's over 200 symptoms that thyroid is related to. It's going to be related to that. And I see it a lot with my patients. I've had men come in, testosterone and estrogen are good levels, excellent levels, and my sexual function is still off. Well, when I replace their thyroid and get that thyroid where they need to be too, then they say, oh my God, my sexual function has improved. So it's one of those three, or a combination of those three. In all likelihood, it's a combination of the three as far as hormonal side of problems related to sexual function.
Now, I've heard a lot about the trimix. Is that part of it, or is that something separate?
It's something separate that we do. It's one or two other things we do to help men. And it's a stopgap typically. We try to get the gentleman... most of the reason if they're coming in for erectile, we want to give them the relief as quickly as possible. Trimix is actually the injectable version of three medicines that will help with erections: papaverine, phytolamine, and prostaglandin. Okay, they're in various ratios, and there's 5 or 6, maybe 10 different types of trimix ratios and different mixes that they have. And what we do is we bring patients in, we do a test dose of it. It's injected directly in the penis, and I can hear a lot of guys and see a lot of guys cringing. But it's only a little insulin needle, and it's only a second, okay, at the most. And the medicine, over about 10 to 15 minutes, will allow them to have an erection. When they come in, we do a test dose and to see how they react to it. And we try to give them a 50% erection and figure out how much time the erection lasts, okay? Usually they'll walk away with the 50% erection. They'll call us back, hey, it stopped at this time. So we'll have the time of how long. So let's say after 30 minutes it went down. Well, then if they were trying to come in and want an hour, then we double the amount of medicines that a part of that actually increase the erection time, okay? And then we give them the full dose to be able to give them the hottest erection they can get, okay? And we do have a doctor on staff that does that. I do not use PAs. I don't use NPs. I used to use a PA, but now I have a doctor that does it. Dr. Britton is primarily who does that for us. And he, so that's another positive for coming to Revita, because you're going to have a doctor do it. You're not going to have somebody that's mid-level, somebody that may not have as much experience. I don't see a problem with that, but again, if there's something going on, they're good to have. So that's the other thing we do. And sometimes men don't want a needle, and they haven't tried the Viagra or Cialis, Levitra, or any of these other medicines that are pill form that help improve the penis and sexual function. So we can prescribe some of those medicines and get those to patients. And I only try to use them as a stopgap until we get those testosterone, thyroid, and estrogen until the levels that we want them to be at.
Right, because we need to tell men, is it safe to really to take all, the Viagra for the rest of your life.
Well, it's funny. They had a recent study come out. I don't remember the exact. I know it's recent that they showed the Viagra may increase your risk for melanoma, which is interesting because it follows the same pathway as what Viagra, what the melanoma tumors follow. So it may stimulate that. So that was one thing that came up that's a negative to it. Obviously, if you're on any nitrates, you can't use Viagra and Cialis because that are medicines that open up your blood vessels because it may cause you to fall out or black out. Okay, Trimix is a little bit better than that for the reason of because you're injecting it directly into the penis and you're not taking it as a pill, you're not going to worry too much about all these other medicines that you might be taking that might, oh my God, it's going to make me pass out. Well, no, we're directly injecting it into penis. We're not giving you a pill that can affect your whole system and stuff. So.
And wow, so we don't have any more erectile dysfunction as a man. I mean, we don't have to live with that.
No, not with all these medicines that we put in, and then partly it's, and as a joke, it's all male Congress, so they pushed a lot of these medicines through. But yeah, there's in the last decade or so, and even longer than that, we've seen an improvement in how sexual function to improve the sexual function of men. In fact, they're doing some things with women and some of these. Viagra and Cialis too, and they're looking to see if it would benefit women as well. I know in some countries outside of the United States they do use it. So
awesome. Well, thank you for sharing about erectile dysfunction with us and having this open conversation because men need to know that there's help.
Yeah.
And Revita Medical is the place to go.
Yep.
Yeah.
Exactly. We'll take care of you. Again, you can make an appointment with us anytime. You call in Richard, he'll get you set up. And again, you're going to meet with Dr. Britton. And if he's not around, you'll meet with me, and I'll help out as best I can with that. So.
Thank you. We need to go online now. That's revitamedical.com. Revitamedical.com. Dr. Peter Fotinos, thank you.
Thank you for having me, Francine.